Okay, welcome all of you. I am Dr. S.B. BANUBAKODE, Professor and Head, Department of Anatomy, Nagpur Veterinary College, Nagpur. Today we are going to learn the new bone, that is the os coxae bone. Now, earlier we have seen that the hind limb is being divided into four regions as the hip region, which is also otherwise called as pelvic region, then thigh region, leg region, and remaining portion is the face region. So the bone which is present here in the hip or the pelvic region, this bone we are going to see today. And this bone is called as os coxae bone. This is the skeleton of dog and os coxae of ox. This is os coxae bone of the ox. It is the bone from the pelvic region or the hip region. Now, how is its orientation? For that, there are certain rules which we need to first learn, and then we will start actually the description of the os coxae. Now, here you can see that this portion is expanded one. So, while holding, you have to hold the pelvic bone. First, I will show you from all the sides. This is the pelvic bone. So, how to hold it? Which is correct? Whether it is to be held like this, whether it is to be held like this or like this. So, which one is the correct one? So, for that, you should first know that this bone has got the three parts. One is this expanded part, which is coming here up to this acetabular cavity. Then there is another part, which is this one. It is also coming here at the acetabular cavity. And third part is, this is a very small portion, which is again coming over here. So, the expanded part, this one, should be kept above. It should not be like this. Here now it is going down. This is wrong. So, the correct way is like this. So, when you are holding it like this, you will see that here there are two foraminas which are called as the obturator foramina. So, this part, when you are holding this expanded portion above, it automatically, this obturator foramina part will be on the downward side. So, that forms actually the floor of the pelvic cavity. And then, whether to hold it this way or this way, again, which one is cranial, which one is caudal, that is a problem. For that, you should, second rule is that while holding it, as I told you, that the expanded portion should be kept up, the obturator foramina should be kept down like this, and then you have to see that the expanded part should be in front. It should not be like this. Now here it is coming caudally and this part is going cranially. This is wrong way. So you should hold, as per second principle, the expanded part cranially. So this becomes the cranial part, this becomes caudal part. Now here we will now actually start with the description of the os coxae. So as I told you that os coxae is a bone from the hip region. This is the hip region. So this bone lies here. It's a bone from hip region. And os coxae bones, they are two in number. This is not a single bone. There are two bones. And there is a fusion of these two bones. Here you can see that in the midline. I will mark it with the chalk. Can you see this separation? So here it is fused. It means this much portion on this side is one part and this one is the other part. Now separately, when you look at this particular bone, you will see that this is. Now this is a single os coxae bone. It looks like this. Again, now again you are likely to face some problems. Therefore, look at all the parts. One is the expanded part, the smallest part, and the part which lies at the floor or this obturator foramina. You can look at this. So, as per first principle, you have to hold the most expanded part above and the obturator foramina part below. Second principle, the expanded part should be kept in front. This is my cranial side, this is my caudal side. So, this is cranially placed. So, this is the correct way how it is to be held. Okay? Now, this portion. So, again we will go back. Earlier we said that os coxae is the bone from the hip region. There are two os coxae bones which are fused at the midline. That already I have shown you that this is the midline which is colored with the chalk, midline. And then we have separated this. And after separating this, you are able to see this particular portion, which is again a single os coxae bone. So, each os coxae means each part of the os coxae bone consists of three bones, and three bones they are ilium, ischium, and pubis. And these three bones they come together at a point to form the acetabular cavity. I will show you that. Now, this one is the ilium part. Here it is coming to form the acetabular cavity. The second part is the floor. This is the floor of pelvic cavity. Floor portion is formed by this bone. This bone is the ischium. Ischium also helps in the formation of the acetabular cavity. The third part is the smallest part. This is the pubis, and pubis also helps in formation of acetabular cavity. It means we can say that each os coxae consists of three bones, the ilium, the ischium, and pubis, which comes together at a point to form the acetabular cavity. This is the acetabular cavity. Now, out of these three bones, you will see that this is the largest bone, and this bone is the ilium, whereas the smallest bone is the pubis. This pubis is the smallest bone. Now, one by one, we'll see the ilium first. Now, this is ilium. Look at the ilium. It is this expanded part as well as this rod-like part. I can say that the ilium is the largest part of os coxae, and it consists of one expanded part which is called as wings of ilium. This portion is called as wings of ilium. The second part is rod-like, as I said, the part which I am holding now. Okay, this part. This is called as body of ilium. It means the ilium has got two parts, the wings of ilium and the body of ilium. First we will see the wings of ilium. Look at the wings of ilium. One surface I have shown you. From the other side, you will be able to see this part. Now, we will see, when you look at this wings of ilium, you will see that it is somewhat triangular in shape. One side, second side, third side. So, it is triangular in shape. And how it is? It is flat because it is here compressed. Anything which is compressed should necessarily have got two surfaces. Anything which is having triangular shape should necessarily have got three borders. So, one border, second border, third border. Anything which is triangular in shape should necessarily have got three angles. One angle, second angle, and the third angle. Okay, so for description, the wings of ilium has got two surfaces, 1 and 2. Three borders, 1, 2, 3. Three angles, 1, 2 and 3. Now we have to name these borders, angles and the surfaces. Now this is one surface, this one is second surface. For better understanding, I will take the earlier specimen again. It is this specimen. Here you will have a better understanding. As I told you that the wings should be kept up and should be kept in front. Then in the living state, this is articulated with the sacrum. This is sacrum. So cranial part of this bone is this, caudal part is this. Towards me is the caudal and away from me is the cranial. So this is one surface and second surface will be this one. Okay. Now this surface is facing where? It's facing cranially. But is it exactly like this? Only cranial? No. It's somewhat slightly oblique in direction. It means some portion of that is facing towards the midline. This is midline. Here, vertebral column. Okay, I'll remove this one. And therefore, we can name this surface as craniomedial surface. And the other surface which is facing caudally, is it facing exactly in the caudal? No. Again, this is also somewhat oblique, means it is facing caudally but somewhat laterally also, means away from the median plane. Therefore, this can be named as the caudolateral surface and this can be named as craniomedial surface. Now, this craniomedial surface is also otherwise named as sacropelvic surface or sacroiliac surface. Why? Because it is this surface which is attached with sacrum. This surface is attached with the wings of sacrum. Look at this. These are the wings of sacrum which are attached with the craniomedial surface. So craniomedial surface is also otherwise called as sacroiliac surface or sacropelvic surface. Then this surface we have named it as caudolateral surface. Now caudolateral surface has got this line. You can look at this line. Here also you can look at this line. This line is called as gluteal line and this gives attachment to the gluteus muscle and therefore the caudolateral surface is also named as gluteal surface. Okay, it means now we have earlier said that the os coxae bone is a bone from the hip region. There are two os coxae bones which are fused with each other at the midline forming pelvic symphysis. This joining is called as symphysis because it's a cartilaginous joint. And then each of the os coxae bone, I said, has got three bones: ilium, ischium, pubis. So this portion is the ilium, this portion is the ischium, and this portion is the pubis. And these three bones, ilium, ischium, pubis, comes together at a point to form the acetabular cavity. And first bone which we have taken is ilium. There we have said that ilium is the largest bone of the os coxae and has got two parts. One part is the expanded one which is called as wings of ilium and second is the rod-like portion which I am holding, so that is called as body of ilium or the shaft of ilium. First we have started with the wings of ilium, means this portion. There in the description we have said that it is somewhat triangular in shape, it is flat type and therefore it has got two surfaces, 1 and 2. It has got three borders, 1, 2 and 3. It has got three angles, 1, 2 and 3. And now we have already named the surfaces. This surface is facing cranially and medially, therefore it is named as craniomedial, and because it comes in contact with the sacrum, it is called as sacropelvic surface or sacroiliac surface. And the other surface which is having this line is the gluteal line, therefore this surface is called as the gluteal surface, and since it is facing caudally and laterally, it is also otherwise called as caudolateral surface. So first surface we will take now, and that is sacroiliac or sacropelvic surface. Now this sacropelvic surface, when you look at this, you will see that this surface has got a line here. This is the line. Now because of this line, you will see that this surface, sacroiliac or sacropelvic surface, is getting divided into two parts as medial triangular part and lateral quadrilateral part. Now in the medial triangular part, here you are able to see one smooth limited articular area. Smooth limited articular area means facet. I will mark it with this chalk. Facet of this side is this one. And this facet is provided for the attachment of, these are the wings of sacrum. So wings of sacrum are like this. They are getting attached with this facet. So sacroiliac surface or the sacropelvic surface is characterized by presence of a line which divides this surface into two parts, the medial triangular part and lateral quadrilateral part. The medial triangular part presents a facet for articulation with the wings of sacrum. And this sacropelvic or sacroiliac surface or craniomedial surface faces craniomedially. That is all about this surface. Now second surface is this. This surface is named as the gluteal surface. The reason also I told you. Reason is it is having a line. This line is called as gluteal line, therefore it is called as gluteal surface. So gluteal surface is somewhat concave. It is facing caudolaterally. It presents a line called as gluteal line, and this gluteal line gives attachment to a muscle which is called as gluteus muscle. So that is all about both the surfaces. Now borders. As I said that there are three borders. 1, 2 and 3. Now based on its location, we can name them. Now first border, look at this. It's somewhat dorsally as well as you can say that it is cranially placed. Therefore this border can be named as cranium. This is outside border, means this will automatically be named as the lateral border, and this will be named as the medial border. So dorsal or cranial border is concave. The lateral border is also concave. But the medial border is deeply concave. And when there is a deep concavity present on any border, we call it notch. Now similar notch is there if you go behind with this. Look at this. This is a notch. Then there is one elevated portion. Again it is continued behind as a notch. This notch is smaller, this notch is larger. And therefore this notch is named as greater sciatic notch. It means here you can see that the medial border is deeply concave and helps in the formation of the greater sciatic notch, which continues behind to form the sciatic spine, which further continue behind to form a lesser sciatic knot. But since it forms a part of the ischium, we will only talk up to the sciatic spine. So medial border is deeply concave, helps in formation of greater sciatic nerve which continue behind to form the sciatic spine. So that is all about borders. Now the angles. This angle is formed by which two border? One is this, dorsal or cranial border. Other border is this is lateral border. And here there is an angle. So this angle is named as lateral angle. So lateral angle is formed by cranial or dorsal border and lateral border, but here at the corner you are able to see this rough protruded area. Rough protruded area meant for the attachment of muscle is called as tuberosity, and this tuberosity is named as tuber coxae or coxal tuberosity. Second angle is this one, which is formed by cranial or dorsal border and medial border. This angle is named as medial angle, formed by dorsal or cranial border and the medial border. This angle also presents a rough protruded area here, and therefore this is named as tuber sacral or sacral tuberosity. Reason is that this tuberosity is near to the sacral bone, like this. This is the sacrum. And this tuberosity, both these tuberosities, they are near the sacrum, therefore it is called as tuber sacral or sacral tuberosity. Then third angle is the ventral angle. This is named as ventral angle, formed by lateral border and medial border. And what does it help in formation of? These two borders helps in the formation of the shaft of ilium or the body of ilium. So that is all about the first bone of the osteo, that is ilium. We have seen here two surfaces, three borders and three angles.